My name is Sue Kolka, and I'm a technician here at the Oradell Animal Hospital, and today I'm going to show you how to give your pet sub-Q fluids at home. Many pets get fluids at home, and it makes it much easier for you if you're able to do it at home in their own environment. What we're normally going to be doing is we're going to be picking up the fluids are called lactated ringers, or there's other kinds of fluids, but today we're using lactated ringers. We're going to have a bag of fluids, we're going to have an IV line, and then we're going to have needles. A lot of times setting them up in the kitchen works best because you can hang the bag up on the IV pole and then the pet can sit on the kitchen counter and it makes it easier for you and for the pet. So we'll start by setting up. The bag comes in a little plastic bag that you're going to tear open and take the bag out. Sometimes there'll be a little condensation on the bag, but don't worry, they don't leak. It should be fine. Always make sure you have the fluids that you're supposed to get to because they all look the same. So just make sure if you need lactated ringers, it says lactated ringers on the bag. Your primary IV set or your IV line will come in a separate bag. Normally there is a little pull spot and you can just peel it right open, but they hide them. There we go. Okay, you can just peel that right open and it'll come sealed with a little piece of tape. You can pull the paper off, like our little garbage pile. And then you're going to untangle your line. Somehow I always manage to make it in a knot. Okay, there we go. So we have the IV line, and this is full of air. So when we set it up, we're going to make sure we get all that air out of the line. We also have our needles. There's all different kinds of needles. Normally, if you're doing fluids at home, you'll be using what we call the pink needles, which is just a specific gauge of needle. But if you have a larger pet, sometimes they'll give you a bigger needle, maybe a green color. So don't be surprised if you have a different size. First thing you're going to do is you're going to take this little top off of the line and we're going to attach our needle to it. We call this cracking the needle. You're going to hear the crack and you're going to pull it open and you're going to discard the little cover and you can see the needle is still pink. You can still see it has a pink color. You're going to attach it with a gentle push and twist. You don't have to really jam it on because then you won't get it off later. If you just do a gentle push and twist, it should stay on with no trouble. Then we're going to attach the line to our bag. The bag has this little white plunger here that we're going to pull out first. It's a little hard to pull out, but it's still sealed. It won't leak on you, so you're fine there. Then you're going to attach your line by pulling off the cap, and it's very sharp, and it is sterile. We want to try and keep it as clean as possible. So make sure once you've taken the cover off, you don't lay it on the table or touch it with your fingers. You're going to hold your bag, pinch the top right about there for support. You're going to go as straight as you can, right into the middle, push it hard and pretty firm, and go all the way into the bag. And now the line is attached to the bag. On the line, there is a clamp right in the middle, right here. This, if it's moving on the line like that, it means it's wide open. We want to close it so it doesn't leak until we're ready to use it. So you're going to crank it all the way down so it's not moving on the line. And then we're all set to hang our bag up. So one of the reasons why a kitchen works good is because you have the hooks on the kitchen cabinet. But you can do it wherever works best for your pet. We're going to hang it up like that. I'll turn it around so you can see a little bit better. So our bag is hanging up and we've got a little well here where the fluid is. Now sometimes that well will get too full, like this, and you can't actually see what's going on because we want to see it dripping. So if it fills too high and you can't see where it's dripping, you're going to tip it upside down and squirt some right back into the bag so we can see what we're doing. There we go. Okay, so now you can see it's about half full. If you start and it doesn't have any in it, you only have to give it about 2 light squeezes and then it'll fill about halfway. That way we can see the fluid dripping. Another reason why it's a good idea to do this in the kitchen is because when we're running the line through, liquid is going to come through the line and squirt out, and we don't want to get your carpet wet. So you're going to pull the cap off your needle very carefully. We don't want to make sure you don't stab yourself. And then you're going to open up your line with our little clamp here. We're going to turn it all the way up, and you can see the fluid is flowing very quickly. Now it starts to drip because it's pushed all the air out of our line, and if you see over here, it's squirting out of the needle. Once we get a steady stream of liquid out of the line, we know all the air is out and it's safe to give it to your pet. Tiny little air bubbles are not that serious, so don't panic if you see something small. But anything bigger than 1 inch or 2, you're going to want to flush that through the line and not have that go into the pet. But little tiny air bubbles aren't a problem, so don't worry. Now we're just going to leave this here while we clean up our mess and get ready for our pet. So this is a good time to then go get your pet and bring them in. And if you're doing the kitchen, the counter works great because it's a little higher. Most pets go on the kitchen counter, but if they know they're not supposed to be there. So sometimes it's good to put them in an environment they're not 100% comfortable with. If you have a really wiggly pet, you can even put them right into the kitchen sink. Put a little blanket down, and then you have a little advantage over them because you're higher. And sometimes that works better too. You can do it in their favorite spot where they sleep in the living room. You can do it in other places in your house, but you don't want to do it in a spot where they're not going to want to go to anymore. So if you ruin where they love to sleep and they can't sleep there anymore, they won't be happy. So sometimes the kitchen counter works best. I'm just going to move this. And this is our little puppy that's going to demonstrate today for our animal. Now, I'm a lefty, so those of you that are watching that are not lefties are going to have to reverse what I'm doing, but it's pretty much the same thing. Most of the time, you're going to have the head facing away from you, and you're going to be giving it this way. So if I'm a lefty, I'm going to bring my line back down, and we're just going to use this little piece of towel as we're going to demonstrate as the skin. So most fluids go on that good spot of skin right behind their necks. Normally, especially cats, they have that scruff of skin back there where they have extra room, and the fluids are going through the skin layer but not into the muscle layer, kind of in the space between the skin and the muscle. It's called the subcutaneous space. The fluid makes a nice little bubble there under the skin. It'll almost feel like a water balloon, and it'll fill up under the skin and it'll absorb over 24 hours. So they'll get a funny little bubble, it'll feel a little weird, but most of the time they don't even know it's there, it doesn't bother them, and by the next day it'll be gone. But right about here in the back of their neck is the best place to go. If your pet's getting it more than once a day or several times a week, try to move it around a little bit so you're not always sticking the same spot, but as long as it's in this area, that's where you have the most room. Now, we're going to pinch the skin up enough to make kind of like a little triangle. The idea is we're going through the skin layer, but not into the muscle layer. So you're almost holding the needle almost parallel with the body. You're going to pop through the skin this way. If you go this way, you'll go into the muscle and that'll hurt. If you angle too far up, you can actually go through the skin and out. And every once in a while, you may see the liquid leaking out of the side of the pet. It happens a lot. Don't panic. Just come on out, change your needle, and you can do it again. So we're going to pull up our skin and make a little triangle. And then we're going to take our cap off. Again, be very careful because it is sharp. And you're going to kind of hold it like a jar. Pull the skin up, make our little triangle. We're going to pop through the skin. And then you can even let go of the skin. And if you're by yourself, sometimes I'll just keep one hand here on the pet so I can feel the liquid under the skin and hold the needle in place. And I'll use my other hand to open up the clamp all the way. I'm just going to pretend so it doesn't get us all wet. We're going to open up the clamp all the way and we would watch it drip. Now, you need to have the needle all the way in up to the pink color. That's called all the way up to the hub of the needle. Because if you're only in about this far, you're going to be in the skin layer but not through it, and that will burn a little. So if you look down and they're suddenly moving a lot and you see that the needle is kind of out of the skin, that'll be uncomfortable for them. So make sure the needle's all the way in. Once you pop through the skin, they really shouldn't feel it at all. It shouldn't be uncomfortable for them. So we're going to go ahead and we're going to turn this on. I just want you to see what the drip looks like, so I'm going to just take it out of the pet for a second. So you're going to turn it on, and you're going to see a nice steady drip like that. That's a normal drip, maybe even a little faster if you're lucky, but that's what will happen, and it'll take about 10 to 15 minutes for the pet to get the fluids, depending on how much we're giving them. But that's the kind of drip you'll see. If it's any slower than that, it might not be in the right spot, so you may want to come out and go ahead and try again. If you've already done it to the pet once and it's not working, you can always come out, but just always change your needle. We'll always give you a few extra needles. Start with a fresh one. We recommend you don't use them more than twice at the same time. If you stick them once and they move and you have to start again, it's okay to go back in one more time. But if you have to do it more than twice, go ahead and change your needle. So we're in the pet, we're giving our fluids, hopefully they're behaving, and we're going to go ahead and give how much we need to. The bags are measured, and they have marking lines on them that tells you how much to give at what time, or on each day. So depending on how much you're giving each day, you're going to watch your lines and you're going to mark your bag. You could use a piece of tape or a marker, Every pet is different. Some of them only get 100 mLs a day. Some could get a whole liter bag in one day. So it depends on the pet. The doctor will go over that with you when you get your fluids, and so will the technician if you get a lesson here at the hospital. So we're all done with our fluids. We've given them, we have a nice little bubble under the skin, and we're done. So we're going to go over and clamp all the way down. You're rolling it all the way down so it's nice and tight. And then you're going to come out of the skin. You can get a little tissue, you can put a little pressure on the hole. Don't be surprised if a little leaks out. It's very common for a little bit to leak out. And if it is a little pink or blood tinged, don't be afraid. That's only because a tiny little blood on the skin mixes with the fluids and it looks worse than it is. So don't worry if it's a little pink. When you go to take the needle off, you're going to very gently put it on, put the cap on and shake it like that. And then pull it down from the sides. Don't jam it on. It's sharp enough to go through the cap and stab you in the finger. So make sure you put it on very slowly and gently. And then we're going to change it, so with another push, and this time you're going to pull and twist, and you're going to take it off, and then we're going to put a brand new needle on it to have it set for next time. So we're going to crack it, and then put our fresh needle on, gentle push and twist, and now our bag's ready to go for tomorrow. If you're only doing fluids every other day, the bag should go in the fridge, and you want to let it warm up about 1 to 2 hours before you give it again. If you're using it every day or you're going through a bag every 2 or 3 days, you don't have to put it in the refrigerator, but to try to keep it longer than a week, you want to keep it refrigerated. If you ever take it out of the fridge and it warms up and it looks a little cloudy, then maybe it's gone bad, you're going to bring it in and we'll throw it away and give you a fresh one. But most of the time the bags will last a week or two with no trouble. Also, sometimes the pets may shake a little when you're giving it. It's not because of anything that's bad, but the fluids are room temperature, which is only about 70 degrees, and a pet's temperature is around 101. So it does chill them a little, but we don't want you to warm it up in the microwave or on the stove or with hot water, because then it will actually scald the pet under the skin. So that's pretty much our lesson. If you have any questions, you can always call the animal hospital, come on down for another lesson, and we can talk you through it, no trouble. Good luck.